Hello everybody, my name is Dr. Shadi Arafij, board certified surgeon, owner of Vet Triage. It's time to comment on the mysterious respiratory disease that has been making its way through news articles and blogs throughout veterinary medical boards, what have you. And there's a few things we're going to address here with this respiratory virus so that both veterinarians who watch this video and pet owners can understand where my thoughts are on this as current. There's a few things to address before we get started in the medical stuff. When we call something mysterious or unknown, I tend to not be a fan of those words because they just create hysteria more than anything. Nothing is really mysterious or unknown. We may not know yet what's causing the disease, but it's not like bronchopneumonia and respiratory disease in general is an unknown, mysterious thing to doctors, and there's lots that we do know. So we use words like idiopathic in the medical field to describe something that is of unknown etiology, which would be appropriate here, but let's not go in thinking that this is some new infectious organism that's plaguing these dogs. It's just not the way things work. So we're going to take that first and put that aside. Let's not get hysterical about this. It is serious, obviously. It's a concern, of course, but let's focus on what we do know and then how to think about it. So here's what we know so far. We know that this is a respiratory illness, so it affects the lungs, the pulmonary system. We know this is a canine issue so far, so perhaps it's not communicable to non-canine species, humans, cats at home, things like that. We do know that there's a marked increase in practices, both general practitioners and emergency hospitals, seeing bronchopneumonia in dogs more than usual. Bronchopneumonia is very common in general, but there's an uptick for sure. We do know that it's not been reported in every state yet in the United States, and I don't know what its status is in other countries, but anyway, it's in a handful of states currently. And we do know that the onset and progression of this disease seems to be somewhat tricky in that some pets can present to a doctor with fairly mild clinical signs, but then it can rapidly progress to pneumonia, which again can happen with known causes of pneumonia anyway, so that's not too strange. But because we're seeing a high prevalence of this, that part of it is a bit weird. But we know that it can begin with fairly vague clinical signs, coughing, lethargy, etc., sneezing, whatever, and then it can progress rapidly within a couple of days or even faster to bronchopneumonia. Here's what we don't know so far, or rather what the missing pieces are. It could be in every state or in more states that are reported. It's just that it's not been reported. This data is based on veterinarians who are finding this condition and then reporting it to their veterinary state officials, right? The medical boards, health departments, whatever, both on a state level and national level. They have to report it in order for this to be labeled as to be present in a state. What also may be happening too is that the most severe cases are getting reported and making the news, but the dogs that have this disease that recover quickly for whatever reason, whether it be their individual biologic variations, or maybe they had a milder form of the disease, or it was caught early, or whatever, or they were treated appropriately early on and went home, did well. There are probably a substantial number of dogs that are affected with this disease, but are not reported because they're not severe cases. We tend to sensationalize those cases that are more extreme, so let's not forget that either. And we also don't want to confuse pet owners either. Not every single dog with sneezing, coughing, lethargy, increased respiratory effort, etc., has pulmonary disease at all, let alone this specific type of pulmonary disease. So those are all missing pieces to this puzzle. And then one final and probably the biggest point here is that veterinarians are subject to what the pet owner wants to perform in terms of diagnostics for their pet. So you can have an idiopathic condition, but it's not really idiopathic because the veterinarian was not able to, or was not willing to, perform all the diagnostics necessary to properly differentiate what the etiology of this bronchopneumonia is. Meaning, clients have to pay for their pet's care. That includes diagnostics, testing. And if the veterinarian has a canine patient in their care that has a respiratory disease of unknown etiology, it's only unknown if all the diagnostics that are possible have been performed to make that conclusion. And those diagnostics are not free. The pet owner has to pay for those. So I bet you, and I know this from speaking to veterinary colleagues as well, and from being in practice myself for almost 20 years, that a lot of these cases either are not diagnosed, undiagnosed, or are underdiagnosed because we don't have the capability of performing all the tests that are needed because the client has to pay for it. If your budget is tight as a dog owner and you're going to focus on putting your funds towards care of the pet versus testing the pet, you're probably going to go with treating the animal, right? Instead of diagnosing stuff, which, fair enough, we can't make you not do that. Your budget is your budget. So veterinarians, and a lot of these, when these cases happen, these outbursts of unknown disease happen, the veterinarian's hands are tied. We are limited by the budget of the client, and this is not to shame the client. This is just the reality of it. This is how it is. This is how veterinary medicine works. We can only do so much as doctors because the client, the pet owner, has to approve stuff. In order for them to approve stuff, they've got to pay for it. So that being said, on the medical side, let's be very careful about calling something idiopathic until you've actually ruled out all other possible diseases. And when you look at infectious causes of pneumonia, more specifically or more accurately labeled bronchopneumonia, they can be parasitic, fungal, viral, and bacterial. Those are your 4 infectious causes. And that's differentiate between non-infectious causes. Like, for example, pulmonary contusions from trauma, or a chemical pneumonitis that turns into pneumonia, for example, right? Or a chest tap that became infected, things like that. Non-infectious causes of bronchopneumonia are different. Immune-mediated causes, for example. Those are all separate categories. Those are non-infectious. Infectious respiratory disease was what we think this is based on how it's acting so far in its epidemiology. 4 types. That's it. Fungal, parasitic, viral, and bacterial. And we have tests to rule things out or rule things in as long as the client approves it. But as veterinarians, we should be very careful for labeling something idiopathic when we haven't ran all the tests yet, right? So everything from blood work to plain radiographs to bronchoalveolar lavage, transtracheal washes, CT scan of the thorax, all these tests are available for us to perform. PCR, but we don't always have the opportunity because either the client won't allow the veterinarian to perform them, the veterinarian doesn't have access to those tests, or the veterinarian didn't think about those tests. And those are real world common reasons why all the diagnostics would not be performed. But as doctors, let's not call something idiopathic unless we've actually ruled everything out. And we seldom get to rule everything out. Even as a specialist myself, I seldom get to rule anything out. And by the time a specialist sees a case, because specialists tend to have all the nice toys, and clients, when they get to a specialist, tend to be ready to spend more money because their family veterinarian couldn't figure out what's going on or don't have the diagnostic tools to figure out what's going on. We're more likely as specialists to diagnose these conditions, but in a disease like this that's moving so quickly, the general practitioner may not have the opportunity to refer the case to a specialist because the pet gets too sick too quickly, or the specialty hospital cannot receive them due to capacity or other limitations, whatever it may be. But again, to reiterate, as doctors, we should not be calling something idiopathic without actually ruling out all the things. So main points of this video to say, let's be more scientific about this. Let's not be hysterical about it. And then finally, what can we tell pet owners besides calm down and don't worry, because you should be worried. It's still a disease and it's real, but I don't want there to be hysteria without a careful thought out process. So here's what pet owners can do. Number one is, because we don't know the etiology of this disease, make sure, number one, that your pets are adequately vaccinated. This is at the recommendation of your veterinarian. Not all dogs need every vaccine. Make sure your pet is vaccinated for infectious diseases. Secondly, let's keep your dogs away from areas of high canine population, so boarding facilities, doggy daycare camps, hiking, wherever dogs tend to hang out. Let's minimize exposure to other dogs to just walking to eliminate pee and poop, and then back in the house again. And then finally, any clinical signs for your dog, respiratory or otherwise, because some diseases, for example, like viral diseases, can affect both the lungs as well as gastrointestinal tract. So any symptoms, but especially those of respiratory origin, until this thing is figured out more, seek veterinary attention, whether it be at a clinic or virtually, is up to you. I will, however, shameless plug, talk about virtual care, because a veterinary clinic doesn't want your infectious disease in that facility, because it could contaminate other patients. And the patients that are at that hospital typically have a compromised immune system because they're there because they're sick. And immunocompromise is a common reason why an individual, human or otherwise, are more susceptible to infectious diseases that your body would normally fight off. So depending on where your location is, your access to care, and what your veterinarian wants to do, it may be good to start off with a virtual platform like Vet Triage, so that you don't introduce your dog that potentially has an infectious disease into the hospital. At the same time, if your dog is substantially sick, which is the point of triage, you ought to seek medical attention, and then upon arrival, they'll ask you what the clinical signs are as a pet owner, and you'll tell them respiratory, if that's what you're seeing, and the clinic has to be able to deal with that infectious disease in a humane manner, but also one that's medically appropriate for the patients in that hospital. So let's keep all those things in mind. So those are my recommendations for pet owners. Otherwise, what can you do to prevent respiratory disease in general in your dogs? Well, let's talk about, eliminating weight gain. We do know that more overweight or obese patients are going to have more respiratory excursions because they're carrying more weight. So you're making them work harder to do basic life stuff like walking, and they also tend not to be as active. And if you have a patient who is more sedentary, they're more likely to develop pulmonary disease of any type if they're more sedentary than they are if they are active. So you want to make sure you maintain a lean body condition. You want to also make sure that the pet, if they have pre-existing conditions, those conditions are managed appropriately. Conditions like diabetes and cancer, thyroid disease, immune-mediated diseases, dental disease, these things can predispose patients to develop other conditions, either directly or indirectly. So we want to make sure your pet's prior medical conditions are under control, adequately managed. And then finally, I would say, if there are aspects of the pet's life you can modify to minimize respiratory disease. So for example, elevating food and water bowls so that the dog's head level is more neutral in position. That way they're not having to bend over to chew their food. It's a more natural position to have it a bit more like collarbone level, chest level. You can do things like adding a little bit of water to the kibble so that every time they chew the kibble, those dust particles are not being accidentally inhaled, especially for those dogs that are fast eaters. So add a little bit of water to the food, or just go over to canned food, whatever your preference is, whatever's appropriate. But let's add a little bit of water to the kibble so that dust particles are not a problem. And then finally, those dogs that are fast eaters, let's slow them down. We don't want them inhaling food particles by accident. And so you can either buy those dog bowls that are like a maze, so the dog has to eat around the maze, or you can take large toys and put them in their dog bowl so they eat around the toys. You can hand feed your dog as well if you have the time to do that. But those are some general pieces of advice to slow down your dog's eating. And that's what I have for you. Hopefully that clears things up a little bit. Obviously, as the story unfolds, we'll learn more as things progress. But those are the key points I want to make. Let's minimize hysteria. Let's think about this scientifically and logically. Let's use preventative measures, and let's also exercise virtual care to prevent dogs from going to other areas and infecting other dogs. This is Dr. Shadi Arefich from Vet Triage, and we'll see you in the next video. Take care.